Hello, and welcome to this Practically Speaking webinar session from the New York State Health Foundation. My name is Maureen Kozine. I'm the Foundation's Vice President for Communications. And today I'm so happy to have with us Sean Gibbons. He's the CEO of the Communications Network to talk about communicating effectively in these challenging times. I'm a proud board member of the Communications Network. So Sean and I go way back, and I'm looking forward to our conversation today and glad that we can have Sean share what he has been learning with all of you. Before we get started, just a few notes. The webinar is being recorded. We'll circulate the link along with a recap of the webinar to all of you and to our broader list. So if you want to share it around, wonderful. The audio and video are disabled for attendees, so please use the chat box to share any questions you may have along the way. Sean and I will have some discussion first, but we'll weave in some audience questions throughout the session, and we'll get to as many as we can in our short time together. So let's get started. First, Sean, can you tell us a little bit about what the Communications Network is and how you shifted your own work once COVID emerged as a critical issue here in the U.S.?
Yeah. So the Communications Network, for folks who may not be familiar with it, is as the name might suggest, it is a network of people who do what we call communications for good. So it's folks who do communications, working mostly at foundations and nonprofits, and we have a small segment of our network that works in consultancies that focus on foundation and nonprofit work, social sector. And our purpose is pretty clear. Our purpose is to connect people, to gather them together. These days that's been virtual, like this kind of gathering, and to keep them informed about best practices and how the field is evolving as it has. The network's been around for about 40 years. And so as you can imagine, it's been a tremendous evolution. We've certainly seen an acceleration maybe over the last decade, and even over just the last couple of months, as I think many folks probably have a sense of just from their own work, their own organizations. And in terms of how we pivoted, like a lot of you, we closed our doors to the physical office of the Communications Network back in March, early March. We were very, very fortunate. The network, when I arrived in my role back in 2014, the network had largely existed like a lot of organizations, nonprofit organizations did. We used a Microsoft Office suite, and we kept all of our files in computers. It wasn't a networked approach. It wasn't, our data wasn't up in the cloud. And so for the last 6 years or so, the network operations have existed entirely in the cloud. And we started experimenting with being a virtual office last year when our chief program person, Tristan Mahabir, moved down to Florida. He's been such a tremendous asset and part of the team. We wanted to let him make that move and explore the idea of working virtually. So we'd had a little experience. We've been using Slack for the last 18 months. And like you all, we use Zoom or have for network webinars for the last couple of years. So we were very, very fortunate in the sense that while we had not worked as a remote or virtual group before, we had a lot of tools in place that we were very familiar with. So that learning curve that many people encountered, we just didn't have to go through that. So we've been very fortunate in that way.
Yeah. And how about your programming? Because you always have shared, as you said, a wide variety of content through events and other communications tactics. How did you sort of approach, oh my gosh, we're in the middle of a pandemic, what do we do in terms of your content?
Yeah, thank you. I think my background, my early career, I worked in television news. And so one of the skill sets I suppose I developed, I'm not sure I knew this at the time, was just a great deal of agility and the understanding that when you walk into a newsroom on any given day, something's going to happen and you're going to be responsible to learn a lot about it and then share that with other people fairly quickly. Maybe you get a couple of hours to digest and sort of make sense of it. And I think it was pretty evident to us in the early days of the pandemic. We just didn't know a lot. We had the sense that a lot of people were going to have to change the way they worked and that there was going to be a lot of stresses on people working in our field and across the sector broadly. And so, I think as with all the things we do within the network, we try to be helpful and useful. And that was the sort of litmus test we gave ourselves. How might we be most useful and helpful? And in the early days, it was, I think everybody over the last couple of months had gotten a crash course in crisis communications, but we started putting together programming saying, what are some of the places where we think stress might emerge, whether it was around thought leadership, whether it was around crisis communications, whether it was around just pivoting to use some of the tools that we're all now becoming familiar with. And so we just started trying to kind of anticipate and ask ourselves the questions, what might we need if we were sitting in, say, your shoes, Maureen, and then just finding folks who are expert and willing to be helpful. And I think one of the things that I've been really enthused about and really pleased to see, and perhaps not even at all surprised to see, is how generous people have been with their time and coming forward to help people and share what they know.
Yeah, thanks. That's been my experience as a member of the network, certainly. And I appreciated how quickly you moved and sort of anticipated your members' needs. One thing that I think we grappled with, especially early on here at the New York State Health Foundation, was this recognition that there is just such information overload, right? Like you're hearing from everyone from the federal government to your yoga studio, like everybody is putting out statements and flooding our inboxes about the pandemic. So how do you think that nonprofits and foundations can best kind of cut through the clutter in this time and communicate meaningfully and not just add to that noise?
One of the things we did really early was we actually looked at the CDC's crisis. Believe it or not, they have a crisis communications manual. They've updated it a few times over the last decade. And P.S., it's 450 pages long. So I don't know who in a crisis can read something like that. But
right.
You know, to the credit of a lot of folks in the network, a lot of people pitched in and helped us to read through it and make sense of it, pull out some ideas. And I think one of the things we learned really quickly was in the early days of an emergency, because this was and is an emergency, the best thing you could do is almost sort of think like an ambulance is coming up behind you and do the very same thing with your communications. Just if it wasn't essential, if it wasn't vital information that could save someone's life or put information into their hands that they could use to help people get to safety, then you might just think about pulling over, you know, literally slow the pace of your work. That's obviously, you know, that's where we were maybe in March and into April. And then obviously in some parts of the country, that's where we are right now. That's probably what it feels like in a Florida or a Texas right about now. But in the early days in New York and such, I think our best sense was slow the pace down of work if it's not essential, communications. And I was really delighted to see, I think a lot of folks did that. There was a lot of internal communications work that also was incredibly necessary. I don't know if this is still true, but in the early days, the folks at Edelman did a quick survey of folks working in our field, or I guess within communications teams broadly across the country. And one of the things they learned was the most trusted source of information for all Americans, believe it or not, was not the evening news, wasn't their local paper, wasn't Anthony Fauci, it was their employers, that they really relied on their bosses and their organizations that they worked for to get them good, actionable information. And so I think a lot of folks in our field also had that sense and took that action. So I think a lot of the communications, sort of the external stuff may have slowed down and the internal stuff probably picked up significantly, and with good reason, because it was really helpful to employees.
Yeah. That's a really interesting finding. I hadn't seen that or hadn't retained that anyway. But you talked about the CDC and you talked about sort of trusted sources of information. I remember really early in the pandemic, it might even have been the very end of March, you wrote this piece that you published in the Chronicle of Philanthropy, encouraging the social sector to elevate and reinforce the messages of those trusted sources, CDC, WHO. But we've been talking about this over the course of the pandemic. Those respected institutions have kind of fallen down on the job, and public trust has eroded. There have been mixed messages. There's a lot of confusion, a lot of mistrust. So what's your advice there today, knowing where we are now versus where we were at the end of March?
Yeah, would I take a do-over? I guess the short answer is in March and April, I wouldn't. I think it's really, really essential. If I'd sent one message out in that op-ed, it was listen to Anthony Fauci. And I would repeat that today. If you can find Anthony Fauci, and I think you've probably all gotten a sense of this, he's been perhaps a little sidelined along the way. And I do think, as is true often with institutions, with big organizations, it's got to be true. No one is perfectly all the time. And that's certainly been true for the WHO. I know there's a debate going on right now about aerosols and how COVID might spread. And within the CDC, there's been very limited, or in some cases misleading or mixed messages around things like mask wearing and such. And we have no national policy. And so it's got to be true that all these organizations could have done better, should be doing better, and perhaps ought to be the folks who are leading the response. And in many ways, they're not. It's now come to, it depends sort of almost where you live, whether it's your mayor or your politicians are now basically offering guidance about what we ought to be doing, which is a very dangerous place to be. So that said, I think it's really essential that folks are looking to science, respected science and data-based information, whether that's coming from CDC or WHO. Something came out from Pew just today, Pew Research Center, that said, and this is just looking at Facebook, and it was just public posts, but 75% of people who were getting information through Facebook, which is a major source of information for people these days, were going to news sites. And those news sites, generally speaking, are reporting both information from trusted authorities like CDC, but also oftentimes using that lens of what is the president saying, what's the governor saying. And so we're getting lots of information coming at us. It's a really crowded information space. I guess if I had to say it over again, I would, and by the way, the really shocking finding from Pew was only 1% of the posts on Facebook, public posts on Facebook that were talking about the pandemic, sourced back to a resource like CDC, like WHO, like Anthony Fauci, which makes me think there's a really dangerous information space that we've entered into now where suddenly, that we probably all felt this, it's gotten politicized, which is really worrisome. So the other thing that's worth maybe noting is Independent Sector did a poll. This came out just about a week ago, I think now, about civic life is broadly what they were looking at. But one of the things they really wanted to know was how trusted are foundations and nonprofits by most Americans. And what they found was really shocking and also very, very encouraging. What they learned was, I think the number was 78% of nonprofits are considered a constructive force for good in society by most Americans. So that cuts across, that's a super majority of people. That cuts across ideologies, that cuts across cultural backgrounds, that cuts across geographic barriers. 78% of Americans think nonprofits are really great. Number was a little bit lower for foundations. Trust there was about 64%, if my memory serves. But let's just put this in context. Most Americans, if you ask them for baseline trust levels of whether it's a politician, whether it's a bank or a business, those levels are down around 20%. So there's a tremendous amount of goodwill that sits with foundations and nonprofits. We are seen as society's do-gooders. And I stand by the idea that if one of the ways we could be helpful was directing people to primary source science information, health information, that is a good, smart thing. Not saying the Ford Foundation or the New York State Health Foundation tells you wear a mask, but directing people to information from Anthony Fauci or others who are credible health professionals or scientists, that seems like a good, smart thing to do.
Great, thank you. That seems like very good advice in quickly evolving times. And folks, we're getting a couple questions from audience members, but please feel free to add those to the chat box, and we'll get to as many of them as we can. One thing that Sean, I thought was so interesting, just yesterday, I think you published another piece in the Chronicle of Philanthropy. This time it was to share the findings of a survey that the Communications Network had done with Atlantic 57. And you asked 275 nonprofits and foundations to share, you know, how they're changing their communications during this time, what trends they were seeing. We'll share a link to that study in our webinar recap because I think it's really interesting to me. Do you want to share some of the highlights of those brand new findings?
Yeah, thank you. It was, well, when we pivoted, we knew we wanted to try to provide people with information, but we also knew it was going to be really helpful to gather back, do a little bit of listening, and figure out how people might be shifting their work. And so that was sort of where this all started. We partnered with some folks, the terrific team at Atlantic 57. They're part of the Atlantic magazine. They do a lot of research, and we've worked with them in the past. And we went out into the field and just asked people, how's your work shifting? And what does that look like for you? And what's the pace feel like? And how are you, what's that work shift look like for you? And what we learned was, this won't surprise anybody because I have a feeling we all know this in our bones by now, everybody's work shifted. Everybody almost within the span of, it was almost shocking, within about a 2-week range, almost everyone went home. And then there was, obviously this is what's been such a challenge because it's been such an asymmetrical crisis that showed up as well just for organizations. Some were really well equipped as we were at the network to pivot to being a virtual organization. Others had a learning curve. But with regard to the work, almost everybody immediately either stopped down on what they thought was sort of non-essential messages or began to develop new ways of thinking about presenting their work using the pandemic and later on some of the work around George Floyd, the racial uprisings, the social justice uprisings we've seen, as weaving that into their work. And so some things that I thought were really interesting. One thing that really jumped out at me was when we went out in the field about 2 weeks before the murder of George Floyd by the Minneapolis police, we asked people, one of our final questions was, if you could see any major narrative shifts, because we know there's going to be a massive shift in how society operates on the other side of this, just probably has to be. We see inflection points occasionally. This appears to be one of them. If you could look into a crystal ball, what might you expect to see as some of the profound places where we could see shifts in how our society operates? And the number one answer was, we think the narratives around health in America will shift profoundly in the coming years. Makes total sense. We're in the middle of a pandemic. But the second most popular finding was, we expected 67% of respondents said we expect the conversation around racial equity in America to shift as a result of this pandemic. And of course, 2 weeks later, with George Floyd's murder, we know obviously there was the murder of Ahmaud Arbery, there was the shooting of Breonna Taylor. Unfortunately, there's been far too many of these incidents over the last 400 years to count. But it seemed like our folks in our field had a sense, or there was sort of, maybe the way to think about it as a forest fire. There was a lot of fuel. A lot of people were feeling the exact same way at the exact same time. And when that horrific video showed up that we could all witness, I think it sort of presaged some of the responses that we saw. People were primed to pivot from the pandemic to moving towards the social justice uprising. That was very, very surprising to me. The other thing that surprised me, which is maybe worth people hearing, because this struck me, was I actually thought in the middle of the pandemic, when so many of us are doing, as my wife and I are trying to manage childcare while we're also working, I really thought there might be more conversations expected in the aftermath or in the coming months around gender equity. And only 2% of respondents thought that we would have a big conversation as a country about gender equity as a result of the pandemic. That surprised me quite a lot, and tells me maybe there's a little bit of work for us to be doing. The other thing maybe worth flagging, and I think maybe this is shifting a little bit, it's been a few weeks since we were out in the field, was most folks weren't listening. And maybe that makes sense because we're in the middle of an emergency, and sometimes, when you're in a very chaotic situation, your concern is mostly with yourself and resetting and reorganizing. But there just wasn't a lot of listening that seemed to be happening at most nonprofits and foundations. And I think we've seen that borne out in some of the commentary that's sort of been playing out through the field or through our sector over the last couple of months, that we need to do a better job of listening to the community and bringing those voices in and lifting them up.
That's so interesting. I think it does sometimes get lost that communication is a two-way street, right? And we have 2 ears and one mouth for a reason. Is that the old saying? So.
Yep.
So we should use them. So you brought up the racial justice issues that folks even anticipated. I know we work in healthcare. It was not surprising to us at New York State Health Foundation to see the disparities in, according to race and ethnicity, in terms of outcomes for COVID. That's something we've been seeing for ages, but it was sort of surprising to me that was news to some other folks who aren't as immersed in these issues. How did you at the network sort of again pivot your work in response to the growing conversation about racial justice, police brutality, all of these protests popping up, all of the things that we're swimming in right now? How did the network pivot there?
Well, I think actually this is where I get to say thank you to you. So the network, this is very much part of our strategy. The network has been dedicated to working on issues related to diversity, equity, and inclusion for the past, certainly across my tenure. So even last year, we published something called, we have a journal we produce called Change Agent. And so we produced something called the Racism Issue, because we were mindful that, frankly, a lot of nonprofits and foundations, perhaps unintentionally, were promoting racist modes of thinking, structural racism. Whether that shows up in some of the images that we use, in the people that we include or exclude in some of the work that we do. We had a sense this has been a bit of a challenge. It's obviously showing up across our society, but that we thought we might be able to be helpful to folks in our field and in our sector. So number one, we had a strategic plan that called for us to do so. I think we also had the benefit of, again, I don't mean to pat ourselves on the back, but the board is a very diverse board relative to a lot of folks in our sector. We have a diverse team. And so it was both part of our sort of strategic charge to be mindful of and to help folks make sense of the moment. And then I think also just for the fact that just the folks who are represented on our board and participate and are part of our leadership group made it really easy for us to understand that this was an essential piece. Everybody needed to grapple with it. And then again, it's just the same sort of ethos that we have. How could we be most useful and helpful to people? And in the early days, I think it was about trying to recognize and lift up some voices of people who were being thoughtful and forthright, and offering up examples of some of the work that we were seeing that we thought was particularly sensitive and thoughtful and perhaps a little bit further along than other organizations who were on a little bit more of a learning journey.
Yeah, you've done so many webinars. You've opened up a new listserv for folks who are engaged with the network where we can all share resources that have been so helpful to me. As I was attending those webinars and looking at the chats there and looking at the chatter on the listserv, there was a lot of angst, I would say, or questioning of, you know, my organization doesn't have a racial equity agenda. We're not a social justice organization. Does anyone want to hear from me? Shouldn't we just kind of stay in our lane? And I think it's something that a lot of folks have really been grappling with. I think part of it is probably that idea of not wanting to add to the noise in a very chaotic time, or feeling that something is going to be just words on a page and not be meaningful. But how do you think about it? What do you think of this, you know, you should just stay in your lane approach?
Oh boy, I probably have some words I can't repeat on a webinar as an initial reaction. I think, look, I understand that we are in a very, very confusing time that's complicated by the fact that we're all in a pandemic, which is creating tremendous stress on individuals and on organizations. But I think when it comes to issues like racism, it's not a political issue. I think that's the thing that shocked me most, was a lot of people thinking, I don't want to be political. And I don't think confronting structural racism or injustice in our country is a political issue. I think it's the baseline for why we declared independence as a country many, many years ago. I think it's been the practice of the United States as a government acting on all of our behalves. When we go and look across the world, one of the major tenets of American foreign policy is promoting human rights and democracy. And so it seems to me that applying that same lens here at home is essential and necessary and a patriotic thing to do. I get that people were a bit concerned. You know, we may not be as far along on our equity journey, but I think leadership is oftentimes a lonely thing. And I think one of the things we're seeing is that this is a movement that's been erupting. And it's shown up in lots of different ways. But movements are strong because of the chorus of voices that are included within them. So I would be very, very hesitant, or I'd be very hard pressed to find a reason why someone might say, this is not my fight and I should step out of this. Especially when you look to other sectors of our economy, whether it's the for-profit space or government, and have heard people stepping up and lending their voice. There's a great power in numbers. And so to me, offering up a statement, and listen, you know, there's obviously, I think a lot of people, particularly white people, have a lot of work to do, and that responsibility sits with us and not with folks in the African American or Black community in America or in other communities of color. But I think the first necessary step is offering yourself up as being open to and awake to learning and growing and adapting. And I think that's essential. I do think silence is a message. And I'd be hard pressed, again, having had a career in journalism, when you hear no comment, you tend not to think there's no smoke there. You tend to think there's a big fire behind the door. So I'm mindful that usually it can't, I don't see any harm in putting forth statements. I do think it's really helpful to be sensitive and mindful and own where you are on your own learning journey. For some folks, I hope the network is in this place. We've been thinking about this and working on this for some time. There's obviously more work for us to do, of course, as for everyone. There's other organizations that maybe feel a bit vulnerable, and I certainly appreciate that. But I think we're in a moment where all of us have been a little bit, what was the line? There's a woman in Canada who's I think she's kind of the equivalent of Anthony Fauci, who said, you know, we're all in the same storm. We are in different boats. And I think we're all very, very mindful of that. Acknowledging that is maybe a first step, that we're all in this extraordinary circumstance. We're in our own boats, but there are ways that we can build them better, and we should step forward to do that if we can.
So pivoting a little, we had a question about grantees. So if you're a foundation, should we be thinking about how we prioritize elevating the messages of particular grantees at this time, in terms of how relevant they are to a particular audience, what tone we want to use, how important they seem to be in this moment, and do you have any tips on how to do this well and to do it responsibly?
Yeah, I think you have to get really clear, as with any communications or any kind of strategic work. The question you have to ask yourself is, what's the outcome we're hoping for? And once you can identify that outcome, I think you have to evaluate, is it worthwhile? Is it going to do more good than harm? Is there going to be value for a fair number of people insofar as you can get a sense of that? And if the answer is yes, then maybe that's sort of the litmus test you apply. I think, again, going back to that independent sector poll, and I'd say this was also true for why folks might think about being forthright about or being bold in the way that they approach some of the recent issues around racial justice, is there is a tremendous amount of goodwill and trust that exists among our fellow citizens for organizations like ours, whether you're a foundation or a nonprofit. And that is a tremendous, Judith Rodin, back when she was president of the Rockefeller Foundation, and Neil Coleman, our former colleague at Rockefeller, who was the communications VP at Rockefeller, wrote a wonderful piece for us many, many years ago when the network did a series with Stanford Social Innovation Review. And they talked about this idea of an influence endowment. And the idea was, not only do most foundations have tremendous resources and assets to bring to bear to help fund wonderful work being done in the nonprofit space, but they also have a tremendous amount of goodwill and standing in society, and that they should use that influence to help shape policies that are aligned with their mission or their goals as an organization. That's a new way of thinking, I think, for many folks in our sector. But it's a way of, I think, helping folks to think about their communications as how might we benefit our grantees by lifting them up? How might we elevate a voice that perhaps otherwise wouldn't have access to the kind of microphone that comes with maybe the New York State Health Foundation? Tremendous amount of good can come from that, I think. Again, I think you have to weigh it against what's the moment that we're in, what kind of an information space are we in on any given day, because news cycles are 24 hours long and veering wildly from hour to hour. But I think to the extent that you can be helpful, Americans are giving now, right, in tremendous levels. So if there's the chance to lift up a grantee and potentially put them forward for a support from other individuals or other foundations, I think that's a good thing. I think all of us have a lot of time on our hands. So again, without knowing a specific, I think helping grantees, raising their voices and uplifting voices, particularly of women and people of color just now, is tremendously helpful. We know that stories are the way that all of us interpret and bring in the world, and they're the stickiest way for us to gather data and make meaning of things. And so offering up organizations that are doing extraordinary work and letting them tell their story is a great thing to do.
Great. We just have time for a couple more questions before our time's up. So I'm going to throw you a tactical question. You announced in the last couple of weeks that you're going to be canceling the network's annual in-person conference. That's your biggest source of revenue, your signature event. You're instead going to host a virtual gathering, which I'm very excited about. I'm sure a lot of people in the audience are in the same boat or thinking about how to make that shift. What's your most important piece of advice for folks who are looking at that?
I think if you're interested in we are learning as we go. So I mean, the first thing I should start with is a deep humility, which is we've not done this before. But we know that there's real power in bringing people together. We know that's why ComNet has been so popular over the years. We also just knew, frankly, making a decision to cancel ComNet was a pretty simple thing. It would not be safe to bring people together in large numbers. Unfortunately, we're seeing that in real time in places like Georgia, where we were supposed to gather. So shifting to virtual was an easy enough decision. Executing it is a big challenge. We're learning every single day. But we've done a couple things which I'm very proud of. One is we're going to make V free. So anybody on this call who'd like to join us, if you go to ComNetwork Virtual, that's COM Network, the word virtual.org, you can register right now for V. We have, I think about 500 folks have signed up for it so far for V. And we just opened the other day. So there seems like there's a bit of an appetite. We're going to have among the folks who will be with us, Rich Besser, who's the former head of the CDC, now president of the Robert Wood Johnson Foundation, Alexis McGill Johnson, who I know you know, Maureen. She was the founder of the Perception Institute, which works a lot on racial bias and how our brains bring in prejudice and unconscious bias. She's recently been named CEO of Planned Parenthood. And we're going to be spending a lot of time talking about women's health and gender equity issues. So we're proud to have her. Joy Harjo, who's a name that may not be familiar to some folks. She's the first Native woman ever to be named Poet Laureate of the United States. She's serving in that role now. She's also a badass activist. So she's going to be with us. And then I'm extremely excited. Nicole Hannah-Jones is a name maybe not be familiar to folks, but you may know her work. She created and has been leading the 1619 Project at the New York Times. And she recently was honored with the Pulitzer Prize for that work. She wrote the Sunday Times piece just this past Sunday, I believe it was called The Case for Reparations, or We Need Reparations Now, I think it was titled. So she's going to be with us as well. And our hope for V is to do two things. One is for the free event, just gather people and expose them to as much information. We're all learning a lot. It seems like a relevant time to bring people together to share notes and share experience and share learning. And then we're going to offer something else called V+, which is an opportunity for folks to gather more in a community setting to build their networks and offer support to one another. And that'll run for a slightly longer duration. We'll be in sort of small groups of people of 8 to 10 to 12, and that'll run September to into November. Maybe early December. But I hope everybody gives us permission to make a lot of mistakes, because we aim to experiment, but as you do that, sometimes stuff ends up on the floor that you hoped would get into the mold or onto the plate. So we're going to do our very, very best.
I think that's excellent advice, to allow yourself to fail as you're trying something new, and it shouldn't get in the way of changing things up and experimenting. Well, thank you so much, Sean. I think we're at the end of our time, but I really appreciate your being here with us. Thank you to all the folks who've joined us. We will send around a recap and a recording of this webinar. As I mentioned, we'll include the link to that Chronicle of Philanthropy piece that Sean just published, and the survey results, which I think are really compelling. We've posted a link to the ComNet virtual meeting here in the chat, so sign up, as Sean said. And please be sure to sign up for the Foundation's email alerts, follow us on Twitter, check out the events page on our website so you can see what other events we have coming up. We have 2 of these Practically Speaking webinars next week, so we hope we'll see you soon. Thanks so much. Have a great day.
Thank you for having me. Thanks, everybody. Bye-bye. Be safe.
Take care. Bye.